Shriram. Let's get started. Please make sure that you would subscribe for the channel. Azygos vein, and Hemiazygos vein. First we'll go through Azygos vein. Azygos vein is present only on the right side in the upper part of posterior abdominal wall, in the posterior mediastinum. It connects superior vena cava and inferior vena cava. It provided with the valves. It may appear tortuous. It drains blood from thoracic wall and upper lumbar region. It forms an important collateral channel connecting superior vena cava and inferior vena cava. Formation of azygos vein. Azygos vein in formation it is variable. Sometimes it may form by right subcostal vein, sometimes by connection of right ascending lumbar vein, first right ascending lumbar vein and right renal vein. It may arise from posterior aspect of inferior vena cava near the renal vein. It ascends through the aortic hiatus along with descending thoracic aorta and thoracic duct at the level of T12 vertebra, and then it enters in posterior mediastinum. From there it ascends and at the level of T4 it reaches superior vena cava and terminates at the level of second costal cartilage. Relations: anteriorly esophagus, posterior lower right thoracic vertebra, that is from T4 to T12, and greater splanchnic nerve. To the left, thoracic duct, descending thoracic aorta. The arch of azygos vein related below to the root of right lung. This is in relation with the root of right lung. It is related with the superior part of root of right lung. It is root of right lung. It arches superiorly. Tributaries means branches of azygos vein. Lower seventh right posterior intercostal veins. Lower seventh right posterior intercostal veins. Right superior intercostal vein, which is formed by the union of second, third, fourth right posterior intercostal vein, and hemiazygos vein. This is hemiazygos vein at the level of T8 or at the level of T7. Accessory hemiazygos vein at the level of T7 or T8. And even right subcostal vein is also a branch of azygos vein. Okay. Now we'll study hemiazygos vein. Hemiazygos vein lies on the left side, only corresponding to the lower part of azygos vein. Formation of hemiazygos vein. Hemiazygos vein is formed on the left, similar to the azygos vein. It may be from the union of left ascending lumbar vein and left renal vein. Sometimes it is left subcostal vein. Here will be one more vein, left subcostal vein. I think I forgot to draw left subcostal vein here. It may arise from left subcostal vein also. It pierces the left crus of diaphragm and ascends vertically in front of the left side of vertebral column up to the level of T8. It turns right and crosses in front of the T8 vertebral column posterior to the aorta, esophagus and thoracic duct, and terminates in azygos vein at the level of T8. And branches of hemiazygos veins are left subcostal vein, left ascending lumbar vein, and lower 3, that is 9, 10, 11th left posterior intercostal veins are the branches of hemiazygos vein. Accessory hemiazygos vein. Accessory hemiazygos vein lies on the left side, only corresponds with the upper part of azygos vein. Accessory hemiazygos vein begins at the medial end of left fourth or fifth intercostal space at the level of T8 vertebra, left fifth or fourth intercostal space, and descends to the left side of the vertebral column at the level of T8 vertebra. It formed on the left side at the level of fourth or fifth intercostal space, and descends down and turns right, and passes behind the esophagus, descending thoracic aorta, and terminates in azygous vein at the level of T8 vertebra. Branches of hemiazygous veins are 5th to 8th, left posterior intercostal vein, 5th, 6th, 7th, 8th, left posterior intercostal veins are the branches of accessory hemiazygous vein. And one clinical importance is if there any obstruction to the superior vena cava, then the whole blood will pass through inferior vena cava and reach the right atrium in case of superior vena cava obstruction. Thank you.